Oh, yeah, yeah, total.
All right. Good afternoon, everyone. Welcome to one of your final sessions of this year's WHS. I'm sure you're all exhausted, but had amazing conversations in the last 3 days. And I'm Hatice Beaton. I'm the Executive Director of the G20 G7 Health and Development Partnership. And it's a pleasure for me today to moderate this important panel that has become a bit of a tradition in the last few years in the WHS to increasingly talk about the role of the G7 and the G20 and the pivotal role that health takes within. But before we kick off the session, if you allow me, we had a fantastic night last night, and some of us got very rich from this night, but for the world's benefit. I would like you to join me to applaud the WHO for this fantastic achievement of raising so many funds last night. So, Katerina. Oh, we have also Secretary Ethel, who's joining us. Thank you. With these good news, and I'm sure, Katerina, you're exhausted, but you're also relieved. So we hope for better health for all, and we will do our best, all of us, as a community. Let me introduce you to my distinguished panelists, and then we will kickstart the panel right away. So on my left, I have Secretary for Health and Environment and Surveillance of Brazil, Secretary Ethel Leonor Maciel. Thank you for joining us today. Dr. Katharina Böhme, ADG for External Relations and Governance at the WHO, and Steve Davis, the co-chair of the III initiative that was created during the Japanese G7 Presidency. Nasir Pupo-Taylor, Vice President, Global Health Systems, Public Health Policy, J&J. Antoine Saint-Denis, Director of European and International Affairs at the Ministry of Labour, Health, Solidarity in France. And Colin McCliff, Deputy Assistant Secretary of the US Department of Health and Human Services. So thank you for joining my panel today. I would like to really kickstart the session by talking about the pivotal moment that really the G20 is facing and the G7 is facing in the last 2 years. 2 years ago, we had a pandemic to deal with. You were all at the midst of the crisis, and we gathered together, all of us, to basically fight this deadly COVID-19 pandemic. However, shortly afterwards, the G20 faced a new dimension of a crisis, and that was incited by geopolitical conflicts, which have a massive impact on health. But also migration flows, demographic changes, and climate change disasters that are increasingly happening have basically stretched our budgets even further away from health than we would have wished after the pandemic. However, as Dr. Tedros nicely said in one of his opening speeches, the best medicine is actually peace, and we are at the cusp of it in this summit here today. So what I would like to ask the distinguished panelists, one by one, if I may say, is now we are almost obviously through the end of the year. You kicked off your amazing presidency at the beginning at the end of last year. And Brazil has done a fantastic job in promoting some of the key health priorities. What do you think, Secretary, was one of the greatest achievements that we achieved for health within 2024 in the G20 and the G7 from your perspective?
Thank you very much. We think as a Brazilian in G20 presidency, the importance of multilateralism, the importance of we have a declaration of climate change and looking for one health approach, and we specifically focus in AMR, which is one of the very important pandemic that we have right now, with that consume a lot of our budget in a lot of our country, and we are doing this and also put the coalition for local and regional production in place to enhance this multilateralism and to I think to say the message that we are very connected, as you point out with the COVID-19 pandemic, even if it seems that we learn a little, very little after pandemic, because we didn't have the treaty yet, we didn't finish our agreement, and but Brazil in the G20 presidency put this idea that is possible, is still possible to create a coalition of the country that change the geopolitics that we are right now with the production line, even if the intellectual production, the IP, is in the some is in the south, but even if some of them are in the global north, the production line is in the south global. So we need to think this and to think more abroad, to have more partners involved in this production line in case of another pandemic, and in case of, as you talk already, and Dr. Tedros make very clear, the conflict, the war that we have, and we don't know how this will scale up. So this is a very complicated moment. We are much more pessimist that we were in the beginning of this agreement with all the geopolitical situation that we are faced right now. So, but Brazil believes in peace. Brazil has this idea that the President Lula launched the Alliance for Fight Against Poverty and Hunger, and he is keeping calling that we are putting a lot of money in arm and war, and not the money for the place that we need to fight against poverty.
Thank you so much, Secretary. And with that, I would like to hand over to Katerina, because I would like to hear from you your reflections of achievements this year, but also in the last 8 years that health has been prominently on the G20 agenda. Where do you see the pivotal moments, and what are the main challenges or achievements we achieved this year?
Thank you so much. And let me perhaps first say, Hatice, that we're super grateful to you, but also Ellen, for having created this tradition and for having this chance each year to discuss the progress we made through G7 and G20. As WHO, we invest a lot of time working with the G20 and G7 because we believe political commitment, including at the highest level, is absolutely critical to drive progress in global health. And despite the fact that we live in a very divided world, we continue to see these places as spaces for constructive engagement that at times manage to overcome the tensions we see. So, you asked about sort of the key success stories, and I would really say that COVID has shown what the world can do when faced by a common threat. And I would say some of the lasting legacies the G20, G7 have created clearly for us were the Finance and Health Task Force, because it's enabled health to discuss and enter into dialogue with finance on a much more regular basis on pandemic preparedness and response, but much beyond. And exactly as you said, I also think that G7, G20 has really helped to put in place some of the building blocks that will also be essential to make the pandemic agreement successful. Notably, the pandemic fund created in Bali with the G20 leaders, the regional production agenda, as you mentioned, which is now being taken forward by Brazil. For us, while many of the initiatives die a silent, slow death, especially when they lack the commitment of multiple presidencies, G20, G7 presidencies, there are lasting, very impactful initiatives that are left behind after this first cycle. And, before I close, I just do want to make a case on Brazil, because in this time of multi-crisis, I feel that Brazil has really acted as bridge builder. And as you said, you know, multilateralism is at risk. And so we're deeply grateful for President Lula for having played this role in holding the world together, bringing us all together, creating a real agenda around the inequalities we see, the trust problem we face, and also by putting huge emphasis on climate and climate health action. So, you know, I do think this prepares us well, not only for the next presidency, but also for COP30, which will be really important. And so in closing, just want to also use the opportunity to thank Brazil, but also thank all of you, because as part of the multilateralism agenda, President Lula, as host of our WHO investment round, has made it a point to say that he really believes in all for health, health for all. And that was sort of the founding and the beginning of this roadmap towards yesterday's event, but also to the G20 Rio Summit. Thank you.
Thank you so much, Katharina. So, Steve, I'm looking at you. You have many hats on, but one of the main critical ones, you're one of the representatives of a birth child of a G7 initiative, which is the III. Where do you see the whole, the big wins for this year in the health financing space from your perspective?
Well, thank you. And again, it's a pleasure to be here, and give credit to Alan as well for keeping us all smart about this. Look, I came into this industry or sector out of the private sector, ex-human rights lawyer, go private sector technology, and the idea is that G7 diplomacy would have anything to do with this was foreign to me 20 years ago, and thought it was pretty irrelevant. And you know, as on the ground practitioner running organizations on the ground, and it's been amazing learning to see how important health diplomacy is to all the work, all the way down to those programs that I used to be involved with in rural Asia. And I would. So first of all, the appreciation that keeping us focused on certain key big themes that are moving the needle. Just a couple quick ones, and then I'll get to the III. One is when the diplomatic community working with the WHO and others starting to set an agenda, which I think is a critical piece of our work. So I would say after many years of us talking about AMR, that now that we have sort of a higher level commitment to AMR, understanding that now we have to go do the work, but that's a good example of how effective diplomacy can be. I'm particularly pleased, even though it's been on the agenda a while, I came out of the digital health space for many years, chaired the WHO's commission there, and to see the progress at the G20 of the WHO initiative on digital health. I think that is actually an example of where it's beyond agenda setting, but actually the table is now set, and we're actually deciding what courses to serve, and I'm excited about the work that Alain and others have led there. So I think that's a nice case study of where it can really go well. We'll see how the one I'm now chairing goes. It's the III came out of the Japan G7 commitment, communique that included a commitment to trying to figure out how to raise more impact capital into global health. How do we get impact investing more engaged in global health? And of course, this is something that is kind of outside the normal G7 conversation. And frankly, most impact investors wouldn't know what the G7 was. So it's not a natural marriage. But what's become very clear as we've evolved this program, working closely with the Prime Minister's office in Japan, but also around the world, is first of all, there's a lot of momentum. There are lots of people thinking about what impact investing in health looks like, why we should do it. It also is important to understand that while there's some logical places where people get both double bottom line return as in using loans or equity in lower middle income countries, in urban and tertiary care, When you get to rural and primary care, the pipeline and the opportunity is less, so we have to figure out better and smarter ways to allow for that. And what is exciting in a weird kind of way is to realize that even though this is all about drawing in more private capital into global health, which is actually my day job at the Gates Foundation as well, but it's actually has a lot to do with government still. So I think we're in the middle of developing those, but there's a whole suite of things that we recognize that G7 and G20 countries can and maybe should be doing themselves, individually, collectively, to actually engender this movement, including policies around incentives, mechanisms. We'll be issuing some thinking about that. But so it's a bit full circle that what came out of a diplomatic communique to help us mobilize will come back to specific recommendations back to some of those same governments.
Thank you, Steve. And you raised something very important, which I will come to after the first round. When Alan and I started this initiative, we had to find ways how to basically advocate in the G20, talk to health ministers, or first when health ministers came together, it wasn't even natural for them. One of the former health ministers, Agnès Buzyn, was saying to us, she didn't know how to navigate the space when she was put into the German health ministerial meeting in the first place. So what I want to touch on in the second round is a bit the psychology. So how actually ministers and ministries started to converge agendas, which wasn't a given at the start, and how the WHO became a pivotal point in the middle. Because that gets forgotten. And people here in the room, most of them don't even know. We talk about the great value of the G7, G20, but what do we actually do? So just a bit that psychology would be also good to hear from our US and French colleagues here, who are representatives of G7 and G20. But before I get onto that, just let's finish the round with Nasia, private sector. Yeah. Where do you see the biggest challenges that we had to face in 2024, and what do you perceive as big wins despite the tense, obviously, environment we operate in within the G20?
Thank you, Hattis. It's really nice to be here and see some old friends and make new friends as well. And I think it's really interesting to have a panel like this and really see people from different sectors of society, right? But that do share the same vision of advancing a more equitable healthcare, across the globe. I think for us, I would have to agree with a lot that was said, for sure. I think a big legacy of the G7 and G20, as you said very well too, is really this recognition of this intrinsic and undeniable connection between health and development. And as you said, maybe a lot of people in this room don't know because we're not involved in the past, but that connection that it's now more obvious after the pandemic has not always been there. This was conquered, it was achieved, and was a result of a lot of work, including a lot of work of folks in this room. So I do think leadership really matters, right? And the leadership of the G7 and G20 in this matter really matter. I think for the private sector, I think the G20 in particular has also provided some really important common spaces for leadership in government and non-governmental organizations and private sector academia to provide input into the agenda. And those spaces are not always there, right? But it's really important so we can come with joint solutions, right, for healthcare. I think in terms, if we talk about legacy for this year, I very much agree with my secretary, Maciel, that the G20 Global Manufacturing Alliance that Brazil is putting forward is a very promising initiative, and we think it could really encourage public-private partnership through voluntary technology transfers to really strengthen healthcare system overall, but pandemic preparedness and response in particular, especially mid-income countries. So I think this is something that we're looking at with a lot of optimism. And I think it does build on a couple of recent achievements of the G7 and G20 that we find very important. One was mentioned here before, is the pandemic fund, of course, really very important. And the other one is the 100-day mission. And I think it's important to talk about the 100-day mission because it is also a space of collaboration, right? Where public and private collaboration is allowed to happen, acknowledging the role of the biopharmaceutical innovation company right, in fighting, future pandemics. So a space where important discussions around strengthening surveillance, R&D investments, regulatory cooperation are all happening. So I think this is sort of, in this year, I think lots of progress under the Brazilian leadership, but also I think we need to mention some recent important progress. Sometimes it's really easy for us to be focused on the work that still needs to be done, but, like Catarina, we were discussing right before the panel, steps in the right direction need to be accounted for and celebrated.
Thank you. Thank you, Nasia. I'm looking at you. So Antoine and then Colin, what are the big wins? Because you worked on some of the key G20 initiatives that Katarina earlier mentioned, Pandemic Fund, IMB, you're in the midst of it all, and obviously the G20 priorities. Where do you see the big wins this year?
Good afternoon, everybody. As you mentioned, I'm the Director for European and International Affairs in the French Social Ministries, namely the Health Ministry. The title changed since we elaborated the program. It's now the Ministry for Health and Access to Healthcare, but also the Employment Ministry. And I'm mentioning this because we do have an experience of the G7 and G20 tracks in relation with health, but also in relation with employment, and it allows us a number of comparisons. The responsibility of my department is to prepare the work for the ministers, but also to attend and participate in the negotiations of the final declarations. And I have to mention also that when the different ministers are not available, I had to replace them. So it's also in this capacity, but also at the light of this experience, that I'm speaking to you today. And I would say the title of our session is about global health diplomacy, and it's certainly about global health diplomacy, but I think we can mention that when you are a minister for health, your primary concern and responsibility is to address your population's needs. It's not to attend the G7 or the G20. But then you soon realize that you are a member of this community and that you already also have a responsibility there. And then you attend and join a number of counterparts and a number of international organizations or representatives of the civil society organizations. And there you realize that the problem of the world and the problems of your counterparts are also your problems. So I think that in terms, you mentioned psychology, I think it's important for me to share this with you here, because in concrete terms, I think it plays a big role, you see, because it's an experience of interconnection, interdependency. Of course, the pandemic has played a major role in this, the sense of urgency. I mean, within the European Union also, I experienced this during the meeting of the European ministers. I mean, it totally transformed the style, the tone, the connections between people. But now that the pandemic is more or less over, but now that we all realize that the world is facing a number of structural challenges that need to be addressed to improve the situation, I think that this experience remains, and remains as an asset, so that we are not back to the world before 2020. And that's a perfect illustration of what is Dr. Tedros' motto, namely that nobody is safe as long as everybody is safe.
Thank you so much, Antoine. Thank you so much. Colin, just picking up on that psychology aspect, I hand over to you.
Oh, thanks so much. And thank you so much, Atis, for the invitation. It's great to be with you all, colleagues and friends, and everyone on the session this afternoon. No, they're really great points and things that we can go through. I'm just thinking, as someone who has been able to spend and does spend a lot of my time in the formal universal negotiating bodies as well at WHO and INB and on the IHR amendments, as well as the informal negotiating tracks of G20 and G7, I think it is really important to differentiate those points. From my perspective and in my experience, G7 and G20 are most effective as platforms when all of us who are participating in it recognize that we're there to really fundamentally strengthen existing platforms, to bring strength to WHO, to bring strength to our collective efforts. I think what my colleague said in terms of differentiating the psychology between, I come from the health ministry in the States, and it's a different mindset that we have and that my bosses have than what the foreign ministry, what the State Department colleagues are bringing. I mean, we all want the same things, but we have different priorities collectively, right? And so recognizing those differences between health ministries, foreign ministries, development ministries, finance ministries, I think is really important. And G20, one of the things that is really great about it is that it really provides that opportunity to bring together ministries in new ways. So I totally agree that the Finance and Health Task Force, that the formation of that and hopefully the continuation of that into the future will be one of the long-term successes, both because of the establishment of the Pandemic Fund, which is a great and needed sort of discrete addition, I think, to the global health financing architecture, but also because, and just again, speaking from my health ministry perspective, at the start of that process, I think most health ministry colleagues will agree with this, we don't speak very well or persuasively to our finance ministry colleagues very often. And so getting that language right, and then the same time from their perspective, and I think my colleagues, if they were here, they would acknowledge this, they don't know what they don't know in terms of what the risks are to the economies, to the finance of their economies and their countries. And so bringing the act of bringing the two ministries together, and also at the same time at the global level bringing WHO and the World Bank together, is really great, because those are also two institutions, and Katerina can attest in her current role that have some challenges, but also when it works, it is really impactful on the ground for countries. And so I think that's some in terms of an opening comment I would want to say. I also want to appreciate very much the leadership of Brazil in this year's G20 presidency. I have been involved going back to Germany's great leadership in starting the health track in the first place with AMR and some of those issues. But I think this year, and it's great to hear, Nasia, your endorsement of the coalition for local and regional manufacturing, because again, as someone who's spent a lot of time in the INB negotiations as well, we spend a lot of time in Geneva, and a lot of rhetoric from our leadership on down is talking about equity and about operationalizing equity. And so, and what Brazil has come up with here with this coalition is a really tangible and concrete opportunity to try to make that happen over the long term. And I think that's another benefit of the G7 and G20 process, is it really is, and others have alluded to it, like, right, we're kind of an incubator for ideas, and you hope that you get that resources and that political will and that attention over time. And sometimes it really soars, and sometimes it doesn't, but you gotta keep trying, right? And it's that iterative nature of this. And this is a very timely and very relevant initiative from our Brazilian colleagues, so thank you. Thanks.
Thank you so much, Colin. What I'm hearing out here is the coalition of the willing, as we always say, is basically converging year by year. In its 8th year, you have an understanding not only amongst each other as health ministries or international organizations, but also between health and finance ministries. And you start learning each other's language slowly but surely. What I would be interested to touch on, going on from there is, what are your experiences, Secretary, this year when the Joint Health and Finance Task Force was sitting? Did you feel like with the Global Manufacturing Alliance, there was tangible suggestions how this can be architected, financed, or when you were talking about vulnerability studies in the Joint Health and Finance Task Force. What is the dynamic? Is there, basically, is there an understanding that the classic grant funding model is not a solution and we need to look at new ways of financing? What was the take of other ministries?
Try to make this the conversation with my colleagues here, and I think this is we are building a conversation, a dialogue, to put in perspective that this is opportunity for public-private sector, as you brilliant said, and this opportunity can be a win-win game. We can all of us can have a win from this opportunity of the coalition. And if you are looking for the pandemic fund that was released after COVID-19 and during this pandemic agreement, and if you look how to say in English, how few money they rise if you put together in this same time period how much money was raised for war, it's so unbalanced. So this tells us what is the political will that we are faced right now. This is because every decision in the government, and this is the first time that I'm in government. I'm from the research field. I'm a professor, and I work all my life, my entire professional life with tuberculosis. And in 1 year of the government, I could make more difference than 30 years as a research in my field. So this is the kind of what I would like to express that the President Lula also express every time. This is a political will. The money is limited, the budget is very limited, and you have to choose in which place you will put this. And it's clear right now that is not for pandemic preparedness. It's clear right now that not for fight against poverty. And it's clear right now it's not for helping the South Global that has facing the most impact that they are less responsible for. So this is what we want to discussing in the G20, and is the agenda that we are taking to the COP30 next year in Brazil, in the heart of the Amazonia region, to show what was happened to that population that didn't made nothing to receive the impact that they are receiving right now. So this is our own responsibility, and we are here in this very high-level meeting to discuss about this and to put climate change and make this the urgency that Colin was saying, that we are like facing the urgency of our time. So this is like the message that we want to share. Thank you.
Thank you so much. Well, everyone agrees with you guys. That's amazing. So one thing I want to basically rethink back. Yes, political will is important. That's what you've all shown. You have the coalition of the willing. I have my thought back. But that coalition of the willing has to have a mandate to execute a plan, correct? So with the Manufacturing Alliance, you have taken the mandate saying we're an emerging economy. We are ready for the BRICS next year as well, to take leadership on creating this alliance and creating a structure around it. And you're one of the new 11 economies as Lord Jim O'Neill outlines it, which is great. So you're giving partners in the private and public sector the way to collaborate with you. But then we have G20 initiatives, like the Pandemic Fund or the Treaty Accord, whatever it's called in the end, that's ongoing. And we have other funds to fill in. So they have many mandates too. So who's taking the leadership on some of these mandates? Because it feels like from our community, again, we're creating too many funds and pots. And how do we converge all of this? Like when I think of next year's presidencies, who's taking this forward, and are we getting sucked into a soup of funding pots again? And how can we maybe give the new emerging economies more of a role and mandate to take the leadership and bring the G7 countries more to the table on some tangible initiatives? So coming back to financing, I'm brainstorming here now, but I wanted to ask you, Katerina, and everyone else, we have half of the world's population is still in a fiscal crisis. So you said it, we have wars going on, we don't have enough money. However, we have these pots and funds, and we need still more money for health and programs to implement those. And we have these G20 initiatives and pots we created. So now, thinking of convergence of G7, G20 agendas, Katerina, how are we going to make this work? Like, how do we converge it? Sorry.
Small problem.
I mean, you have the money now, so how do we make this work?
I have a feeling you completely deviate from script here. Well, so let me perhaps take it up from where you stopped, which is in general, we see that health is being forgotten again, right? To be very honest with you, in so far the discussions with Canada, there's no health in sight, right, on the entire G7 agenda for next year. For South Africa, we see that health will be central, and I think that's what it has to be, not only because of what you and several of you said, because health is so critical for the economic stability, but also because it's a bridge and peace builder, right? And in a very tense world, actually when you look at the health declarations, they had content, they brought us forward, they drove progress, which was not the case in many other areas. So, if you asked me what my advice would be for any president in any G20 or G7 presidency, it is to make health prominent and to keep driving the health agenda. And the health agenda linked to all the other areas we discussed, right? Because I think G7, G20 is most successful when tackling multi-sectorial programs, right? And that's why, clearly, right, building on what we have, i.e. further strengthen the ties between health and finance is a must and not a given, right? Already this year, the finance ministers on the 31st of October will join only virtually, right? The health ministers will be there in person. We have to make sure that there is a real meaningful dialogue. Otherwise, we will, on the health front, lose the arguments again and step back rather forward. I think we have to build out the multi-sectorial, right? Climate and health has not yet been sufficiently tackled as a topic, needs to be linked more into the finance discussions. Digital health and AI, you mentioned it, Steve, also a topic that needs to be linked and hooked in still more with the other ministries and sectors. And perhaps more specifically to your question on financing, right? I mean, as you said, it's shocking after 12.5 trillion economic impact of this pandemic that at the WEF, the risk of pandemics basically ranks at the bottom of the risk register, risk 23 of 26 global risks, and that the spending in most countries shows very big downward trends already 2 years after the pandemic when it comes to preparedness, but also when it comes to health overall. So, where are really these new pockets for sustainable financing? And I'm glad that South Africa will make this a main topic for their presidency, because as you said, we've not really been successful. For the pandemic fund, we hoped the money would come out of defense budgets, that it would be additional rather than cannibalizing other pockets. Has it done that? I would say the answer is clearly no, right? So have we truly found any new pockets of funding that came into health? Not really. We as WHO, as you said, are working much differently with the banks, and we would say that's a massive success. Our partnership as WHO with the World Bank has never been as solid as it currently is. Our partnership with IMF on the Trust and Resilience Fund has never been as strong as it is. The multilateral development banks step up, but in the end, this is about loans, right? It can never be, it's a piece of the puzzle. Debt financing, you know, is a big topic, debt restructuring, right? So this will never give us where we need to go. We have to look at it more holistically, and that's where I'm coming back to where I started. We must not lose this health and finance dialogue, and it's at risk right now, so let's bring it back
Thank you.
and strengthen it further.
Thank you, Katrina. Very strong message. We must maintain the dialogue, and yeah, that requires another applause. Come on. We must maintain the dialogue. That is so true, and this is your responsibilities as governments to keep talking to each other and keep conveying the messages to us. But then I look at Steve. So you talk to a lot of these investors, right? And how do you convince them in which pot they can put their basically bet in to contribute to the greater good?
Yeah, well, it's hard to follow Katrina on this one because I think the critical issue is, you know, making sure this is at the table, on the table, and because it is getting, it's shocking how much it slips. But I would take a different, an additional approach. It's additive, but when you say multi-sectoral, and I totally agree, let's check AI and technology alongside of health, alongside of climate, but I would also take the other approach to multi-sectoral, which is how do we bring private sector, civil society, and other sectors into this as well. Look, you know, one of the most interesting things that's happening in actually financing health, not necessarily at the macro level, that at the G7, G20, but is these new blended financing mechanisms that are, you know, pulling in some private, some public. DFIs are issuing, you know, certain kinds of instruments that help de-risk some of these commercial investments for certain kinds of things. So I think that there, you know, it's not going to fill the gap. I'm going to be super, super clear. Like there is not a gap filling, you know, for large ODA development assistance writ large. But there are really interesting things happening. The blended finance. I think the other area that's quite interesting is to see how you know, different philanthropists are coming together to decide to pull together large funds. And those are funds that may be targeting a very specific area, but we've seen the IND Fund do some extraordinary work on global health. I think we'll see a beginnings fund in the next few months, you know, that is going to work on child survival. And it's pulling together literally hundreds of millions, if not billions of dollars. Now that isn't going toward, it's very programmatic. It's not going toward institution support. But I think those things are out there and they're part of the puzzle. And I think we need to have them more overtly at the table. Okay, and they're actually quite efficient, the way that some of these funds are working. So I think that helps the case for money. And then finally, I think you know, what we also need to do is keep, and I believe this so strongly, that we need to take a multi-regional approach to this. I mean, there are global mechanisms and global instruments, but a lot of this, particularly, you know, on the innovative financing side, on the sort of health collaborative side, is coming out of regional efforts. So what sort of the models where the Indian government's working with philanthropists and working with a suite of civil society partners and putting together a structure that is working brilliantly on certain critical issues. And we see that emerging in Southeast Asia. We see it emerging in the Middle East. So I think that we have to start thinking about this much more multi-regionally, and that will give us more lift.
Thank you so much, Steve. I think you mentioned one very important point here. In times of the pandemic, during an emergency situation, we actually saw when we interviewed a couple of asset managers and investors in a report we did. There was an 11-fold increase in additional investment coming from the asset management investor community. By default, we didn't even have to find them because they saw the need to find the pots to put their money in. But does it always have to be an emergence? No, we can do it preventative as well. And some of the private sector actors, I'm looking at you, Nasia, here as well, you have some great initiatives as well where you're already adding into a health system strengthening approach without facing a pandemic. So can you tell us a bit about the examples you're working in the financing space?
Yeah. Great, but first I'll give an example to what Steve just mentioned. So I think, and I want to pick up on a trend here, I absolutely agree with what Katarina said. I mean, keeping that very high level political focus on health, it's not a given. So it's everybody's role to keep that. I also agree here with Steve that it's not, there are very interesting new ways of investing in health. There are not the solution for all, but like he said, those are good pieces of the puzzle. So I wanna address some of those, perhaps two pieces of this puzzle. So I agree that the blended financing and impact investment are really interesting. There's some really interesting things happening there. I want to give you an example of how the Johnson & Johnson Foundation, for instance, is investing in impact ventures. So we have an impact ventures fund that is, it's a fund of $50 million that's continuously investing in small companies and entrepreneurs that are particularly focused on improving health equity for underserved patients around the world, right? And the Impact Ventures Fund at the Johnson & Johnson Foundation was recently created in 2019. We initiated investments in Kenya, and now we have a portfolio of 21 investments across the 5 portfolios. And like was mentioned, I mean, these funds have dual purpose, right? They aim to generate financial returns, but absolutely have a positive and measurable societal impact. So I think there's a lot of people in the private sector doing very interesting things, and we're a piece of this puzzle. So this particular fund is still relatively early in its life cycle, but the portfolio of companies that we have invested already reached 3.4 million patients and support more than 90,000 healthcare workers around the world. So I think this is the proof that investment and impact can come hand in hand. So I think this is one piece of the puzzle in our view. I think another piece of the puzzle on how we can improve sort of overall healthcare system financial sustainability, if you will, is really focusing on efficiency and effectiveness of healthcare systems. And we have a long way to go in those two aspects. So, and that's where, and going to answer your question, I think that health innovation can play a really important role in offsetting, budget constraints and improving efficiency of the funds that we have, that we invest. Pharmaceutical innovations, medical innovations overall, the earlier they move into the treatment pathway and, medical technologies become more effective, less invasive, we really do have the ability to reduce long-term costs in the system, right? And this will lead to better patient outcomes, but it will also just overall better use of the resources that we have available. We also know, and I think sometimes we have to remind ourselves of some sort of basic parameters, right? The earlier we intervene, prevention is better, is the best, but the earlier we intervene, the more we cure, just the higher the returns of the investments in health that we make. It's just, it's a simple equation, I think. So absolutely to Katarina's point too, I mean, governments do have, of course, the leading role in healthcare systems, and these are big questions that need to be answered by governments, and it's, the pieces of the puzzle will not solve everything. So direct investment by governments and domestic resource mobilization will always be the critical and the most important aspects. But, I think there are solutions that can come from bringing diverse points of view to the table and creating the spaces, as I mentioned before, for really co-creation of solutions between different members of society. So I don't know if I answered your question.
Definitely. Thank you so much, Nasia.
Yeah.
I'm just thinking, so Katarina made a good point. So if I'm not mistaken on the numbers, 1.7 trillion is at the moment around 300 DFIs, Development Financing Institutes in the world, small, medium, large. They accumulated have around 1.7 trillion in capital that they can deploy in grants or loans. Loans alone, or this grant loan model, will not solve the issue. However, if we would set the political incentive as a government, a mid-income emerging economy or a high-income economy, work structurally with these multilateral development banks, bring the investors into the dialogue to show the ROI case, these type of initiatives in health system strengthening for healthcare workers are very tangible to measure and show, for example. I'm not just talking about TB vaccines, which we will touch on later on, but these are very tangible examples. Smaller interventions, bigger impact. And France, for example, I'm looking at you, the development agency in France, you have incredible blended financing mechanisms as well that you're deploying all around the world. What's your take on the new ways of financing models and the role of governments to help enable those to close the SDG 3 gap until 2030, ideally?
I'm not a financial expert. I'm not from the development ministry, but from the health ministry. So it's up to my colleagues to invent and scale up the best financing mechanisms. But listening to the previous speakers and also coming back to your initial question, I was thinking that we are all very much aware that we are facing structurally two types of difficulties. First of all, we definitely need money for the world and for health, but the needs are infinite and the money is not. Mm-hmm. And second, as you mentioned, we are confronted to fragmentation. We are confronted to fragmentation. So we must navigate within these two difficulties. It doesn't mean that we should not try to reduce this fragmentation, that we should not try to mobilize more funding that the world needs. But in practical terms, how to make progress in this? France insists a lot on the need in this context of fragmentation to put WHO in the central role, because that's the only way to facilitate some order within this fragmentation. Second, coming back to what it means for the G7 and the G20, it certainly means that it's up to these organizations and together with the UN organizations to assemble the different pieces of the puzzle and to try to think together both a number of emergencies together with a number of structural needs. I mean, basically primary care, universal health coverage, and so on. And second, to keep the political momentum, because we can't be sure to mobilize all the funding that is needed, but we can be sure that if we fail to keep the political momentum, then we will not manage to do our best. So it's certainly a responsibility for the G20 and the G7 to keep this political momentum. And that's why we are so grateful in France for the work done by the current Brazilian presidency when it comes, for instance, to the health and climate declaration. It's not a consensual issue. Yeah. The negotiations are difficult, and the minister is at the core of them. But it's worth trying, and we can be sure that we will be, at the end of the year, in a better position thanks to this political commitment from the Brazilian presidency. We also hope that the G7 Canadian presidency next year will have an ambition for health, because we need it. We need it because we are beyond the pandemics, but the problems are still ahead. So it's worth it. It's worth it for the world.
Thank you for highlighting the horizontal challenges, because climate change, of course, is an environment minister's problem, but has a direct effect on all of us, our health. So thank you for opening that pot. As you said, now it's a contentious maybe topic, but in 3 years' time in the G20, we will have a mandate and it will have a clear focus. And this is how these topics evolve. So thank you as well, Brazil, for opening that pot. Looking at Colin. Over to you on the trends on financing.
Finance, sure.
You have USAID, amazing initiatives at USAID as well. Do you want to touch? Yeah.
Sure, just a little bit. And I will, like my colleague, I'll have to defer to them, but we do work very closely with both USAID and Development Finance Corporation, who are, and this is where I think it can be quite interesting. Again, recognizing that we are struggling with this fragmentation, but one way to address that is to focus the energy, and focus on the mandate in each institution correctly. So the pandemic fund itself, for example, really more focused on prevention and strengthening IHR core capacities, those kind of issues. I mean, it's a debate, I guess, in the board, and I also won't speak for our board member, Ambassador Nkenga-san, but we have said that the day zero surge financing, for example, that can be handled in other ways through some of these innovative measures you're talking about that like our own DFC colleagues are involved in, working with other partners in the G7 economies and beyond. So I think differentiating again the roles of these different actors can be helpful according to their mandates. Since I do have the microphone, I want to really appreciate and endorse what Katerina said about this moment that we're in on the finance and health collaboration not being a given. And I'll just, without naming names, I just recall very vividly one of our first meetings of the task force following I guess, rollout of the pandemic fund. Some of the colleagues were like, well, why are we still meeting? We already did the thing, so it's over now, right? And we're like, no, actually, this is kind of an important channel that we need to maintain and continue. So I think certainly support from every quarter to the different G20 economies to talk about the value of this. And I do think it's important also take my homework as well to our friends up north when I get home on the health track in the G7. But I think the G20 is so valuable just because if we look at COVID, and especially, again, I'm thinking more of my INB and IHR negotiating experience. If you're in the 172 countries or however many outside of the G20, it's really challenging, right? Because the G20 economies together are really both the source of the solution and the problem for the rest of the planet, right? And so in terms of both developing those solutions and then hopefully, again, taking a more equitable approach in how access to those solutions takes place. And so again, like my colleague, I want to thank Brazil for your leadership this year, and it's going to be a very interesting transition from Brazil to South Africa, and see if we can really drive those equity elements in a more operational way. Thanks.
Thank you so much. I want to just pick you up on the equity approach. India, Brazil, South Africa next year, all BRICS countries, all G20 member states, all emerging economies. And also, they have the youngest population for the future, if you look at the demographics, so huge potential. If you now think of the achievements of this year, creating the Global Manufacturing Alliance to get a structural dialogue going, giving more impetus to the pandemic fund. We had a big year on AMR. We have shown that resistances to antibiotics are basically an ecosystem problem, not only in our food chain, but also in the poultry farming, in the water we drink even. So to make health and finance ministers understand that, how we can curtail that. Then you have emerging killers that we start talking about again, TB. Half of Latin America, the biggest burden is TB, malaria. It's on the rise again. So COVID made us forget about these, obviously, diseases that affect vulnerable populations. So the point I'm trying to make here to the round, and I mean, anyone who wants to pick it up can pick it up first, is now we touched on many of these diseases and structural problems, and maternal and child health has emerged again as a big topic in the global community. So with all of these topics that we're dealing with, and the structural needs that we have that the WHO has to put into place for us. Where are we seeing, what are we expecting basically from the second cycle of the G20 presidency? I'm thinking now long term. So we have all these challenges. This first cycle is ending end of next year before United States takes over again. So what are we expecting from the second, basically 2 decades of the G20 taking these topics forward? Can you give us a bit of an outlook where you see these trends going within the discussions you are having on the G20 or G7 platform? Wow. Yeah. Sorry, I'm giving you a hard time in the afternoon, but sorry.
So what we try to think like 1 year, 2 decades, that's a long term. And of course we are learning with this experience that in each year, each country within the presidency want to put their own priorities.
Yes. Yeah.
So it's very hard to tell to the next one, let's keep in this moment. So it's not an easy conversation. So we have to face this and to keep in this moment, to put this, the climate change in the center. We don't know. We expect that there is a continuation, but we don't know. What we are thinking, and I will give a step back to see what we are doing in with the United Nations in COP29. We are discussing right now with the Azerbaijan a declaration to be signed in Baku that we will keeping the health agenda in the COP for like a more stable subject, not to keep this like, this is my term, I'm not put this. So this is the idea to keep this moment. So we didn't have this in G20. I don't know if with the job that Steve will be will take this in G7, this will be possible. But maybe it's one thing that we can put in the agenda to have some kind of continuity. But right now we don't have this. We don't know what the United States will do. Probably they are thinking something, but it's complicated. And it depends a lot of what was happening in the moment in that year. So this drive to the decision either. So to make things more sustainable, have this declaration or some kind of document that we are trying to do. It's not a guarantee, but at least it's a document that everybody agree with this and can have a more impact inside our country. So this is what I think the best way to do this in G20, in G7, to have this declaration in agreement in the end. As Antoine told, we thought when we start to do this climate change declaration, that was so easy. Everybody will agree with this. Everybody wants a better world. It's like a piece of cake. But it's not. We get stuck in a lot of details, very complicated moment, and we have to call an intermediate meeting to see it and try to make our difference less than possible. And now we think that in October, the end of October, we will have this 2 declarations. So let's hope. And we need to have something to show the world that we agree at least in the common terms. So this is what we are working for this.
Thank you so much. I mean, this is so important you're mentioning it. Sometimes people think there is a long-term planning of putting some topics on the agenda. Sometimes it's also being tested to see how the community reacts, and you've done a brilliant job on climate change. And as you said yourself, rather than pushing certain policies forward, you actually used a new structure of COP implementing health permanently into the COP structure, so you can embed yourself into these discussions. There are many funds in climate change that we can tap into to look into which of those have a health component as well without taking the climate change agenda away. So these are not easy discussions, and I'm giving you all a hard time this afternoon, but just want people to acknowledge as well in this room that these things don't happen overnight. So even if you try, it is a long-term negotiation and many externalities and political dynamics happening, obviously, within the G20. But over to you, Katarina. You mentioned, do you want to jump in?
Well, I mean,
Yeah.
it's sure.
Over to you, okay? Can I jump? Okay.
Sure. Sorry, you had just said everybody can jump in. So anyway, I think that I agree with everything that the Vice Minister has said. I think it is important for colleagues who aren't as familiar with the G20 process, and G7 for that matter, to know how important the presidency is, right? There is that continuity going through, and so you see things, but that continuity is not a given, just as Katarina was saying. So you have to build that in and kind of work with that. So it's the troika of the past president, the current president, and the future president is a very important part of that continuity and seeing that through. And then I think exactly it's exactly the right move. If you can get something in writing, then it's not a guarantee, just as Ethel said, but it's at least it's the closest thing to a mandate going forward that you can then have. I think the other thing that just going back to my last set of comments, that I think the next, given that I don't think it's hard. It's not a revelation to say there's not any 20-year planning happening in any of our capitals, because they're all looking from 1 to 6 months or 2 months in our case to anyway, or it's a very short-term planning thing. Yeah, 3 weeks, whatever. Yeah.
Who's sweating?
I know, not sweating at all. Yeah, exactly. So it's very, very close. But I think the issue, and this goes back to COVID again, that I think all of the G20 have to honestly grapple with, and it's the theme of this overall conference, is trust and lack of trust. Before the pandemic, there was just a lot of or expectation that that the G20 or the G7 or whatever would say something or do something, and then they would do it. But now that trust is broken, and I think rightly so. Because of the pandemic. And so what are we going to do collectively as a G20 to rebuild that trust? And I think, again, this is why some of these earlier elements about how do we not focus on our own selves as the G20, but focusing on the institutions like the WHO and the banks, what have you. How do we strengthen the multilateral institutions so that they can be more effective for all of us, including those of us not in the G20?
Yeah, just I want to pick you up on that point. You mentioned famous word troika.
Yeah.
Man, you love acronyms in the G20 and G7. So half of the room maybe doesn't know what troika means.
Okay.
Yeah, troika, dear audience, is how the past, current, and future presidency works on common themes to carry them over and create legacy initiatives, ideally, which we, as the external civil society, keep reminding you on to create these legacies. So you stick to basically common narratives, so we can also contribute to those goals. And you're right, these decisions are not a given, but the continuity is onto the G7 and the G20, and you can see in the last 3 years, there is more convergence even between those two agendas of the countries. And this happened because of, obviously, your force to bring it into that dimension. You mentioned South Africa, how they will take on the Sustainable Financing Initiative, some of the aspects you mentioned on climate change. So this is very welcoming for us to see. I think, Katarina, you just wanted to jump right to Colin's statement, yeah.
Yeah, so I agree fully that, as you said, this is going to be largely driven by political realities, and agility is also important, let's face it, right? We can't plan this 20 years ahead, but perhaps sort of more putting my medical hat on, next year, when this new cycle starts, will be 5 years to the Sustainable Development Goals, right? And so I do think that the first 5 years of these presidencies will have to focus on let's accelerate towards SDGs and let's shape the post-SDG agenda. And, when I think sort of from our WHO strategic perspective, what would be needed to achieve SDG 3, it's clearly in parts what you said, for example, the massive healthcare worker gap we see. Human resources for health is one of the things that hold back any area. It's stemming the tide of NCDs. It's tackling the golden age of science, right? How do we use innovation and how do we maximize the benefits, but also manage the threats of innovation that we see? And, I see here our co-chairs of the Youth Council, and they would perhaps, on the one hand add that yes, it's about the what, and so planetary health, moving from health to planetary health is clearly something that we think should get more attention going forward. But then also when you think about the how should G20 act differently, right? One thing you've said, the last thing we need is more shiny objects, more completely new initiatives. It's already a completely fragmented space. So how can we build and strengthen, how can we build on and strengthen existing mechanisms? Let's make sure the Troika becomes the norm, not the exception, because all these initiatives can only be successful if they have the support of at least 2-3 years, 2-3 presidencies. The how, can we create spaces, more spaces still for civil society, spaces for youth voices. I don't see that a lot yet in the G20. There is a women empowerment working group now, which I find very important. But I think, it's not only about thinking what's the priority agenda, but even much more also about how can we work better and create even greater impact in the next decades.
Thank you so much, Katrina. I think, Nasia, you have direct comments to that one.
I would love to talk a little bit, if that's okay, Steve, about the healthcare workforce piece. And I don't know what the G7, G20 will prioritize, but I've learned that if you don't ask, you don't get. So I'm going to ask for a prioritization here. It's, if we think about, a key priority in health at the context of G7, G20 is advancing universal healthcare and strengthening universal healthcare, where is perhaps in need of strengthening. And there is no universal healthcare without healthcare workers, right? The world is facing a tremendous shortage and burnout of healthcare workers. And we cannot overstate, the importance of healthcare workers, particularly nurses and community healthcare workers, those that are really on the front lines of the day-to-day responses and the pandemic response and whatever we need, right? So I think if I could have an ask for the G7 and G20, yes, there will be year by year what is the issue that needs to be addressed at that moment, that is most salient, that has a political appeal. But if we don't make a long-term commitment to UHC and within that strengthening healthcare workforce, we're not going to get there. I do think that the private sector has an important role to play there. I think innovative ways of financing as well. We, through the Johnson & Johnson Foundation and Johnson & Johnson, we have invested in the African Frontline Catalytic Fund that is hosted by the Global Fund. We really want to impact, a large number of countries, 8 countries in Africa, and really help train and develop a community healthcare workforce. Just last week in Washington, D.C., we signed with USAID a memorandum of understanding to really make our contributions to strengthen healthcare workforce across Latin America and the Caribbean, and its contributions to support the American Health Corps, We hope to impact 500,000 healthcare workers in the Americas region, and we invite other members of the private sector to join in those efforts because we need everybody really on board. We were particularly honored to have the director of the Pan American Health Organization, Dr. Jarbas Barbosa, come and witness the signature of this agreement with USAID, and we do need to acknowledge the absolutely critical role that the WHO agency in the Americas play in strengthening healthcare workforce. So this is my ask to the G7 and G20, since I get the chance to ask something.
Well, here you go. That's the moment. If not you,
Can I ask my ask?
Yeah, go ahead.
So, like, if everybody gets their wish list.
Oh my God. Okay, here we go.
But look, I'm the least diplomatic up here. In fact, not a diplomat at all. So that will, I might. This may not land well. But I did actually.
Can I say something? You're sitting in the middle of them, so.
I know. I realize, but it's a bit intentionally to be provocative. But I have to say, I did actually run the largest foreign NGO in China during the pandemic, so I learned a few diplomatic skills. But one is, I would hope there is more focus on implementation than declarations.
Yeah.
I think the world outside looks at all these declarations and just rolls their eyes, to be honest. I know it's a central piece of moving the ball forward, but the amount of effort and community energy that goes into getting a 5-word declaration in a G7 is outsized compared to the impact it has on the world. And so I would say fewer declarations, more implementation would be number one. Number two is recognize we live in a fragmented, increasingly multi-regional, increasingly fragmented world. So don't fight that. Use that. And I feel like in some ways there's this sort of a lack of looking at regional answers, not looking at empowering regional movements and leaders. And because of the sort of nature of a G7, G20, it favors the incumbent, for sure. And so how do we get out of a G20 mechanism that favors the incumbent, which would be the second. Third is, I think there's no question that in the next decade, and you said it already, Katarina, but innovation is going to be one, and it sounds so, kind of talk about an eye roller, like, oh, here's the innovation guy again. But it is the thing that's going to get us out of this. I mean, and I'm not just talking about product innovation, but financial innovation, service innovation, disruption is the only answer, because there's no possible scenario that we're going to keep doing the things we've been doing for the last 15 years and get our way out of this. We have a hugely different global economic, economic infrastructure. The role of China, the role of India, the role of Indonesia are completely different than when the G7 and the G20 were structured. And I just feel like the lack of disruptive thinking is getting in our way sometimes in health diplomacy. Okay, I'm done.
I think just to add on to that, and I'm giving it over to Antoine, health does not naturally have a face. So what do I mean by that? When you look on your TV, you see melting icebergs, you see disasters, and it's easier to relate to something. Whereas what you are all doing on your day-to-day, unless it's a pandemic, unless it's COVID and we see the challenges right away, the normal population doesn't see what you're working against. So how can we bring a face into the health challenges? For example, how can healthcare workers are a clear example. This is a tangible way of showing results and impact. And when we speak about infectious diseases developing or promoting innovation, how can we rethink to give a face to innovation, right? I'm philosophizing here a little bit, but let's think of that way. And this is how we basically grasp the rest of the communities as well, who can give you tangible suggestions. And thank you for your little wish list, you too, but heading over to Antoine to react to those.
Yeah, that's a good, everybody has seen that I'm able to ask very difficult questions. But this is, again, certainly an excellent question. but I'm not sure I fully agree, because I think that health for everybody in the world is something very concrete. Maybe not when you are a young person, but at least when you start getting into trouble, you realize that health matters. You see, what is certainly less concrete for people is that beyond your individual relationship to a nurse or to a doctor, there are health policies. But even regarding this, I think that everywhere in the world, citizens have realized how much their personal health depends not only on their village or minister, but also on what happens elsewhere in the world, for medicines, for financing, and so on. So there is something here where on which we can build. I think that, I'm not sure we have already mentioned the word of prevention. But I think that even if we are all aware of the need and the potential for innovation, the tremendous potential of AI and so on, and even if nobody knows what will be the agenda of the G20 or G7 for the next 20 years, I think we can be sure that we will have to discuss more about prevention, because without prevention we will never manage to face the human resources challenge, the financing challenge. And what is interesting here is that if we manage to put more knowledge, more political impetus on prevention, then we will better manage to interconnect the expert aspects of health and health as a social issue, which means that not only taking the right decisions for the populations, but also embedded the populations in individual health care and in a number of collective choices. And that's where the technocratic aspects are connected with the democratic aspects. And we must manage to make some progress regarding this, because that's a condition to better serve our populations. And here, the G7, the G20, they are not organizations. They are not international organizations. So we should definitely not expect, well, they can launch a number of initiatives, they can put light, they can create policy objects. I fully agree, of course, about the need for implementation. But the G7, the G20 do not have the capacity to implement. They can take care, but that's all, you see. And that's why the UN organizations and a number of more operational organizations are not only instrumental, but critical, you see. But there is a need, and there is this capacity to put some political energy in health also as a social issue, and not only an issue for doctors and experts, and also embedded the population in taking care of everybody's health.
Thank you so much, Antoine. Very wise words here. We have 1 minute left. And I know the health community is its own worst enemy to keep short statements, but I will try. We touched on many topics, and the common themes were trust, believe in multilateralism again, create horizontal new forms of financing mechanisms, talk to each other. Don't lose the hope on health and finance ministers talking to each other. Do work together to unlock new health funding resources, and obviously put health at the epicenter of obviously humanity, and also link it with other challenges such as climate change and migration challenges. If you now were to speak to the next incoming G7, G20 presidency, what would be your one advice that you would give them as a take-home message that you would like to see next year to be implemented there? A policy, a framework. I start with you because you actually have one right now.
So in 30 seconds, oh my gosh, we think that we need to keep going, to keep fighting against social determinant disease that affect the most part of the population around the world. Even in the rich country, we have a very specific population that suffer. So I think social determinant disease will be very important. Thank you.
Thank you so much. Katerina.
I would say keep health and the linkages to the other sectors prominently on the agenda. And you know, Steve, you have convinced me to say, and break new grounds by doing so, by taking stock, but also measuring implementation progress.
Steve.
Well, I would say whatever Katerina says. then I would say, and as it relates to empowering innovation, think less about product innovation, but more about policy innovation and financing innovation. That's the real need.
Nasia.
Keep advanced universal healthcare coverage for everyone, everywhere, on top of the political agenda. And to do that, supporting the people that help deliver that, the healthcare workers of the world.
Thank you so much. Antoine?
I would say just go on, because policy making is not about reinventing the wheel every year. It's about insisting, of course, at the light of relevant objectives and determined implementation and indicators and so on. But it's about insisting, because that's a condition for progress.
Perfect. Colin?
I'll add my voice to Nasia's that basically addressing universal health coverage and health system strengthening is foundational to health security, which is core to so many policymakers' minds. Thanks.
Thank you so much. Thank you, everyone who came here this afternoon. And thank you for the distinguished panelists.